Good afternoon, everyone. Sadly, we have today reported another 19 COVID-related deaths in Northern Ireland. And again, my deepest sympathies go to the families and friends of those who have passed away. Because as we battle through the next phase of this pandemic, let us never forget the toll that it has already taken. Let us keep at the forefront of our minds all those who have lost, all those who have been bereaved, and all those whose health has been badly affected by this virus. And let us never forget the immense sacrifice of our health and social care workers, the burden they have carried for us and continue to carry. Because let no one underestimate the sheer challenge they face of working across the system, but especially on our COVID wards, under the strain of full PPE, knowing that for many patients they may well be the last face that they see, working well beyond their hours to support colleagues and to stay with patients in their final hours. So let's not be distracted by the very small but vocal minority who claim that the COVID threat is an exaggeration. They have been discredited. The facts are clear because their constant undermining is nothing but an insult to health and care workers. Let me today say that to all our staff, we need to look after them, not just now, but for the years to come. And we as a society will have to look after our health service better than we have done in previous years. The health service is up against it right now, and the pressures are without parallel. This morning there were 869 COVID-confirmed inpatients. That's 277 more than this time last week. That rate of growth is wholly unsustainable. We have already heard from our trusts the devastating impact this is having on our services. Last week I announced a regional approach to the prioritisation of surgeries. That means those who need an operation the most will get it wherever there is capacity. Right now, I would rather ask people to travel further for treatment than not get it at all. But in the meantime, the best way to protect the NHS and all the staff within it is to stay at home and use its precious resources responsibly. In response to the levels of transmissions across the country, the 4 UK Chief Medical Officers recommended that we now move into Alert Level 5. This impacts on the implementation of visiting guidance in all care settings across Northern Ireland. So today, I unfortunately can't confirm that my department has produced revised visiting guidance, which will be placed on the departmental website and which the trusts will be highlighting locally. Whilst there are areas that I have ensured visiting will be still permitted, that will be such as our hospices and our care homes, visits to general medical wards will no longer be permitted. The new visiting policy will be implemented from this Friday. However, it will be kept under constant review, and as soon as it's possible to lift the level of restrictions, I will. As we face into this vicious storm, let us remember that there is hope. The vaccination programme is our pathway to those better days. And while there is a long way to go, it has made a very strong start. I can report today that Northern Ireland has already pushed well past the 100,000 mark. By close of play yesterday, 109,259 doses had been administered, with 91,419 people having received their first dose. 458 out of 483, or 95% of our care homes, have received their first dose, and 67% their second. And with our GP-led vaccinations barely off the starting blocks, already close to 20% of our over 80s have received a jab. And we are just getting going. The programme will be scaled up rapidly as supplies allow. And I have to emphasise again that availability of supplies is the key limiting factor at present, not locations or staffing or operating hours. Supplies are limited. We cannot vaccinate everyone right now as much as we would like to, but we will get there, steadily and systematically. The supplies will keep coming in batches, and we will keep prioritising in line with the Joint Committee on Vaccination and Immunisation guidance. The vaccination programme is yet another example of our health service rising to the challenges. Throughout the past year, I have been constantly humbled and amazed, not just by the dedication and expertise, but by the enthusiasm, the collaboration and the innovation. And this is continuing despite all the challenges. Another important innovation can also be announced today. In the coming week, a new rapid test for COVID-19 is rolling out to all our trust emergency departments across Northern Ireland. The Limera DX is a rapid nasal swab test that delivers results inside 12 minutes. It will enable emergency departments to very quickly identify patients who do not have COVID-19, enabling much faster decision-making on their care. Belfast Trust has been working as one of only 5 pilot sites across the United Kingdom to trial this rapid test, and I commend everyone involved in this major project. I can also report today that the lockdown measures that we have in place across Northern Ireland are producing results. The R number for new cases is coming down in line with our objective of getting it below 1 again, but the challenge, of course, is to keep it there. The lockdown provisions will be kept under review by the Executive, and we may well have some further challenges and decisions to make by early February. We will have to avoid easing restrictions too early or too widely. The situation in our hospitals is too precious for that. We are not through the worst of this yet. Nevertheless, I want to conclude on a positive note. I want to thank the public across Northern Ireland. The vast majority are doing the right thing. You are abiding by the restrictions and doing your very best to fight back against COVID. Please keep it up. This is definitely not the time to ease up. We are all tired, but I can assure you we will get there if we stick together and stick to the right path. So let's build on the progress that we are currently making. And I will now hand over to the Chief Scientific Advisor, Professor Ian Young.
Thank you. It's been a couple of weeks since I've had the opportunity to talk about the progress of the epidemic, and I want to look at what's been happening to cases and in our hospitals over the last period since Christmas. The first slide shows the average number of new cases per day. We saw the expected very substantial rise in cases to an average of over 2,000 per day as a result of mixing before Christmas and during the Christmas period. In the last few days, we've begun to see the number of cases falling, although I have to stress that they remain at a very high level. And even now, as we see the numbers falling, getting lower, they remain at a higher level than at any time in wave 1 or wave 2 of this epidemic. So what everyone is doing is working to reduce cases, but we still have a long way to go. Demand for testing has risen as there's been higher levels of infection circulating in the community, but we have continued to be able to offer a test to everyone who needs one through our testing centres. Test positivity is an important indicator of the extent of community transmission, and as for the number of cases, it rose to very high levels shortly after Christmas, but now has begun to fall again, though still remaining high in historical terms. So what we see on cases is positive and encouraging. If we look at local government districts, then we see that over the last week, numbers of cases have fallen in every area. However, they remain very high, well above 500, particularly in Mid-Ulster, Newry, Mourne and Down, and Armagh City, Banbridge and Craigavon. Nonetheless, there are high levels of infection everywhere in the community. We need to remain very cautious. If we compare Northern Ireland to the other parts of the Common Travel Area, then we see that current levels of infection are a little lower than in England, significantly lower than in the Republic of Ireland, where there's been a marked rise in the post-Christmas period, but still somewhat higher than both Scotland and Wales. The picture is very different in our hospitals compared with what's happening with cases. There is always a lag period, a delay between cases peaking, people becoming infected, and then a number of days later, those cases translating through into hospital admissions. We're still seeing the number of hospital admissions rise day by day. It hasn't yet peaked, although hopefully will do so in the next few days. Numbers of admissions now are higher than at any point during the course of the epidemic. And the same is true, as Minister Swann has indicated, of the number of inpatients with COVID in our hospitals. That will not peak, I think, until sometime in the last 2 weeks in January, so long as we all continue to adhere to the restrictions. Unsurprisingly, we're also seeing the number of COVID patients who require critical care rising. It's now at about the same level as it peaked in wave 1 and wave 2, and still, I think, has some way to go. So pressures on critical care will continue to get worse. Deaths in hospital are also now at a peak. Unfortunately, it's inevitable that deaths will also continue to rise and remain elevated for some considerable few weeks before we begin to see a fall again. In terms then of restrictions, how are we doing? This table looks at mobility to different locations in the April lockdown and in the course of the last week. What we can see in April, for example, was a 65% reduction in movement to the workplace. In the first week in January, we saw a 43% reduction. We're not doing as well as we did in April with the stay-at-home message. And the same is true of retail and recreation, of trips to the supermarket or pharmacy, and of trips to parks. In all of those categories, we're making more journeys, mixing with more people than we were back in April. Unless we can get those numbers down, unless we can all do better with the stay-at-home message, we're not going to see the same reduction in R that we saw during the April lockdown, when R fell to between 0.6 and 0.7. That is the challenge, to reduce those non-essential trips from home, to stay there for a bit longer to get the maximum out of this period of restriction, so that the pressures in our hospitals will fall as quickly as possible over January and February.
Okay, thanks, Ian. I asked our Chief Medical Officer, Dr. Michael McBride, to say a few words.
Thank you, Minister. Thank you, Ian. Sadly, today we are reporting the deaths of 16 more people from COVID-19, and I want to extend my sincere condolences to all of those bereaved, family and friends. Sadly, we've all become too used to hearing such tragic news, and we will continue to hear that news for some time to come yet. We should, however, never become immune to the implications of those deaths, nor fail to recognise the part that we can all play in reducing those deaths. Whilst we are no means out of the woods, as the Minister has said, there is hope for better times ahead. The current restrictions won't last forever. We will be able to see family and friends again. Vaccines and new treatments are our way out. but they're just not here now and not just yet. Now is not the time for us to relax. The rollout of the vaccines has delivered much anticipated hope for the beginning of the end that we have all been waiting for. We published our vaccine plan yesterday, and whilst ambitious, it is deliverable. The rollout of the vaccine programme in Northern Ireland has been an outstanding achievement, and I want to thank every single person who's been involved in that, and I want to thank the public, every member of staff who's come forward to avail of the vaccine. We have made a very solid start, and I am confident that we will continue to build on this. Whilst this is to be celebrated, I do need to stress the importance of understanding what vaccines can do and cannot do, what we know and what we don't yet know. Vaccines are undoubtedly a game changer. They are our route map out of what we've all been living through over the past year. But they do not make the virus disappear. The jab offers us protection from COVID. It stops people getting ill or very ill. And that means in time, as more people are vaccinated, the pressures on our health service will ease, and that is vital. That is the breakthrough that we need. But that doesn't mean that those vaccinated can forget about coronavirus. It cannot be a free-for-all. It can't be party time or a time to throw caution to the wind. People who are vaccinated have to keep taking all those measures that keep every one of us safe. While we know vaccines protect people who receive them, we don't yet know what they bring in terms of infectiousness and transmission to others. They may well stop people passing the virus to others. We just don't know that yet. We must also remember that no vaccines are 100% effective. Some people will benefit from the full protection that the vast majority will enjoy, and some will not. Research into all of these factors is continuing. Until we get definite answers, there is an ongoing need for caution. That vigilance, your efforts, has saved many lives over the past 12 months, and it remains essential. This is not the time for anyone to let their guard down. As the Minister has mentioned, we will shortly be rolling out a new rapid test for our emergency departments, and this test delivers results in 12 minutes and will have a significant impact on patient flows in our emergency departments into our hospital wards. The Belfast Trust was one of only 5 early pilot sites across the UK to trial the new Limera DX rapid test, which has now been validated and tested locally. And there are many other positive innovations happening right across all sectors of the health service, and we should all be encouraged by these and proud of how our health service has responded. Please do remember, if you have an acute medical condition or a deterioration in an underlying condition, the health service is there for you, and you should not delay seeking medical care. We should also take time to consider all those working in health and social care whose tireless commitment and efforts over the last 10 months has been extraordinary. We owe each and every one of them a huge debt of gratitude. At present, and in the coming weeks, they will be tested like never before. They will not be found wanting, nor will they let you down. Please do not let them down. Please stay at home. We are now seeing a slowing of the infection rate, and I thank every one of you who has followed the advice and adhered to the restrictions. So for now, I'm once again asking everyone to stick with it, stay the course, see it to the end. We are almost there. Please stay at home, protect our NHS and save lives. Thank you, Minister.
Thank you.
Afternoon, Minister. Can I first ask you, at the moment, given the pressures on our hospitals, are you literally closing your eyes at night praying the system can get through this?
Yes, Sharon, I am. and that's when I get to close my eyes at night and when I can. Because I think the scale and severity of the impact that COVID-19 is actually having on our system is like nothing we've seen in living memory. And it has required our entire system to learn, adapt and take action in the most difficult circumstances. And this past week, when I saw a number of our trusts having to confirm a downturn of elective surgery, does reflect the unprecedented pressures that COVID-19 and the pandemic is creating in our hospitals. But I'm assured that every attempt will continue to be made to protect the most urgent of our surgeries, where this is achievable, and that postponed operations will be rescheduled as quickly as possible. But what I will say, a system that was struggling to maintain itself this time last year, pre-COVID, is fighting its hardest at this minute in time to support the people that need it when they need it most.
And on that, Minister, we just heard that the number of COVID patients critically ill and very dependent on oxygen is increasing. Do you fear it'll get to that stage where difficult decisions will have to be made by medics of who to save and who not to?
I hope we don't get to that stage, Sharon, because we've put in every protocol, every protection that we can. And I suppose one of the things that we have learned throughout this pandemic is that of a regional approach. And that's why we've seen recently, patients unfortunately having to be moved between hospitals to make sure that we can get them the support measures that they actually need, should that be in regards to access to oxygen. And I'll stress, it's not about supply, it's about the infrastructure to make sure that they receive the supports that they actually need. So one of the things that we have actually established is that like a command and control hub, which both manages the flow of our ICU patients and those that need respiratory support. And that's now working on a regional basis as well, so that if we have to, and it is, I suppose, a last resort, that we have to transport patients between hospitals, we have the ability to do that, and we're approaching it as a regional approach, because I think that's how we are coping as a health service during this wave of this pandemic.
Hi there. Just a question for the Minister first. Minister Swann, what's your reaction to the news that organs donated by deceased donors are being turned down for kidney transplant because of COVID? Is there a strategy for restarting that programme?
Well, I think that we do need to differentiate between deceased donors and living donors. Unfortunately, one of the steps that we've had to take is actually reduce the number of living, or actually stop the living transplant while we fight through this level of COVID. In regards to the deceased donors, I'm assured that the transplants where they are critical and of critical need, that assessment has been made, and they are still proceeding as is necessary for those who are most critically in need, where that cannot be sustained in any other way. But maybe, Michael, if you want to give a bit of further detail specifically on that.
Yes, thank you, Louise. And I think we can all but only apologise to those individuals who've been affected by this decision. It's not an easy decision, but it's about managing people awaiting transplant safely, given the high levels of community transmission, and also the need to prioritise access to surgery for those with life-limiting urgent surgical needs, including cancer surgery, which again has been sadly impacted upon. I think we need to bear in mind that, as Minister has said, for those individuals who are highly sensitised, and therefore it's very difficult to find matches, that the deceased kidney donor programme is proceeding. Sadly, that is not currently the case in terms of the live donor programme. But let's bear in mind that the Belfast Trust continued through the first wave, and the second wave was the live donor programme, and indeed over that period transplanted 101 individuals in 101 days. So I think we can be rightly proud of our kidney transplant programme in Northern Ireland. But sadly, at this present moment in time, given the rates of COVID transmission, the pressures on our health service, sadly some very difficult decisions have had to be made. But again, that's kept under constant review and will be reinstated as soon as is practically possible. Patients will be kept under regular review and surveillance so that they don't deteriorate. But my sincere apologies to all those affected.
And just then, the restrictions are due to be reviewed next week. Today, we've just had the announcement that the AQE is being cancelled at the end of February. Now, there won't be an AQE exam this year because of ongoing uncertainty about the lockdown. Chief Medical Officer, you warned yourself that easing restrictions in February was optimistic in the extreme. Is it better to prepare people now and tell them that this is going to go on for much longer than the 6th of February than to create false hope that the shutters will come up and people will be mingling again in as little as 2-3 weeks?
Well, ultimately, those decisions are matters for the Executive and for Ministers. Ian and I will continue to provide advice in terms of our assessment and levels of community transmission and the risk of any relaxation in the current restrictions. This virus isn't going to go away. And its added complication is the presence of the new variant. We know that that new variant is widely established across the rest of the United Kingdom and the Republic of Ireland, and we had evidence that it's established in Northern Ireland prior to Christmas. There is no doubt that levels of that new variant are rising, and that makes the job twice as difficult, because we know that new variant is between 40 and 60% more transmissible. So situations where the virus may not have transmitted in the past, with the old variant, the virus will now transmit with the new variant, and that's why we need to be extremely cautious in the weeks ahead. So this virus doesn't magically disappear on the 6th of February, and there may well be very difficult decisions for the Executive in the weeks ahead. But as I say, ultimately those are matters for the Executive.
Okay, Louise, and I think what we would be asking at this point in time, as you know, we introduced this period, where we come into this period on the 26th of December. We're 3 weeks through with 3 weeks to go. So it is about the people of Northern Ireland doing what they know they have to do, abiding by the restrictions. You know, I'm heartened by the buy-in that we have got. There are still more we could do as a society. There is still more that we can do in regards to knowing what we've done before, what we've done in the past. Because when we see the pressures on our health service, and I've said this before, you know, our actions today does have an impact as to where we'll be in 2 weeks' time. Our actions 2 weeks ago has had an impact on where we currently are today. So it's an ask that I make on behalf of our health service. You know, please do what you know you need to do to cut down the rate of transmission and break those chains of transmission as well. Hi, Rebecca.
Good evening, all. A trade union has this evening described schools as an unsafe environment for both children and staff. I just wanted to ask what your assessment of that statement is.
Well, I haven't seen the statement, Rebecca, but the Executive is committed to keeping education as a priority and opening schools when it is safely to do so. One of the things that we have been constantly doing as a department, and the Chief Medical Officer and the Chief Scientific Advisor, is providing that best practice, that guidance, and updating the Education Authority and the Department of Education in regards to even international best practice or recommendations that comes forward from SAGE as to how we can reduce the risk in our schools, because I think we've been very clear there is no location, no locality, no activity that is completely COVID safe, but what we can do is introduce measures that actually reduces the risk of transmission.
Thanks, Minister. And just secondly, have you considered asking the armed forces for their assistance in rolling out the vaccine to free up health staff to try and support health services?
Rebecca, one of the continual engagements we actually have at a departmental level is with the Ministry of Defence and with the armed forces. That has been ongoing since the first pandemic. They've been able to help us with logistical guidance, with logistical advice, and also with even some of the very crucial transfers that we had to do during the first wave, and taking those critical patients across to ECMO facilities in the northeast of England as well. So we continually utilise our armed forces here in Northern Ireland. It's a conversation and a piece of work that continues even at this present time. Hi, Tara.
Hi, good evening. Question for yourself, Health Minister. First of all, you have warned about the grave situation in our hospitals, and we've seen it playing out. We saw today 869 inpatients. Is it inevitable that we're going to hit the 1,000 mark soon, and what plans do you have in place to try and combat that?
Well, Tara, unfortunately the hospitalisations that we see today are because of actions 2 weeks ago possibly not even the actions of those people in hospital, but the actions of people around them who may not even be known to the people who are currently in hospital today. So there is no, and I suppose it's one thing we always want to do, there is no blame or negativity around having caught COVID or being in hospital. It's something, as a virus that is present, and as a virus it transmits itself very easily. In regards to our projections, and they are that in regards to the number of hospitalisations, I think our worst case scenario shows a need of 1,200 hospital beds. I hope we don't get there, and as we are in regards, and I think Ian indicated earlier on, we are starting to see a decrease in positive cases. That has a knock-on effect as to regards as to the actual hospital admissions. The 1,000 would be a challenge, a major challenge for our hospital system. It's one our surge planning is preparing for. It's one as we're looking at from a regional approach, and that's why we took those very difficult decisions in turning down those elective care procedures, those outpatient appointments, so that we could reposition our health service, the workers in it, and our hospitals to support high numbers of patients, which we're prepared for, but we hope don't come.
Thank you. And a question on the vaccine then next. We've been hearing some concerns from people who are immunocompromised and just not quite clear about the safety of it for people who are immunocompromised and who perhaps are shielding. Can you shed any light on that?
Well, I'll turn to the Chief Medical Officer on the specifics of that, but that guidance will come out via their GPs. It's already there in the Green Book that's produced on each vaccine as to the work that's done through the MHRA and the JCVI actually on new vaccines, but I'll let the Chief Medical Officer pick up on the specifics.
Yes, thank you, Minister. Just to reassure individuals who are immunocompromised or those who are clinically extremely vulnerable, they need have no concerns about the safety of this vaccine. Obviously, we know that individuals who are severely immunocompromised, their ability to respond to a vaccine may be somewhat reduced, but we have no evidence at this point in time, and there should be no reason whatsoever why individuals should have any undue concern about this vaccine. All of the relevant guidance is available in the Green Book, as the Minister said. It's available to all our general practitioners, so please take the advice of your general practitioner, the practice team. They are the experts, and they will advise you accordingly about the appropriateness of vaccine, and indeed if you have any allergies as to whether or not there are alternative vaccines that you should consider.